What's up, everybody? Happy Tuesday. Yeah. Get this thing off. All right. Good evening, wonderful viewers. Welcome to another exciting episode of Know Your Pharmacist Livestream. I'm your host, Dr. Joaquin Acosta, CEO of Pharmtrue, where we blend science with compassion to revolutionize healthcare, guys. Tonight, we're embarking on a captivating journey through the dynamic world of health and wellness, and I'm thrilled to have you all with us. As we dive into today's segments, we're going to connect, collaborate, and uncover some of the most interesting developments in healthcare. We're not just discussing topics, we're building a community of informed, health-conscious individuals. Your engagement and insights make this journey not just informative, but incredibly rewarding. Our Pharmacist Frontline segment will explore Rite Aid's innovative move in Maryland, empowering pharmacists to dispense hormonal contraceptives. Something we've had the luxury, for our pharmacists here in New Mexico to have. However, the corporate world doesn't exactly recognize that sort of prescriptive authority. Anyways, this is more than just news, guys. It's a groundbreaking step towards accessible healthcare for all. Our Tech Talk segment after will take us into the heart of Walgreens' leap into virtual care. As an expert in the field, I'm excited to brainstorm with you the implications of their bold new steps in retail healthcare. In the Enlightenment Hour, we're going to segue right out of that and delve into a fascinating study from UT Austin revealing the nuanced impacts of telehealth on healthcare costs. This is where science meets real-world application, and I can't wait to share these insights with you guys. In our Herbal Wellness Corner, we will deep dive into the complex relationship between cannabis and mental health. Here, we're going to blend ancient wisdom with modern science, creating a captivating narrative around the versatile plant. In our community spotlight, we're celebrating the spirit of giving with our Coat and Food Drive by High Horse Cannabis Company. It's all about connecting with our community and making a real difference. And finally, in our Men's Health Minute, we'll have some fun with fascinating mustache facts, adding a touch of lightheartedness to our discussion tonight. So sit back, relax, and let's embark on this enlightening journey together. Your participation makes this live stream not just a show, but a movement. Together, we're not just learning, we're transforming healthcare one episode at a time. Thank you for joining us. And a special thanks to our sponsors, Pharmtrue, High Horse, Vado Speedway Park, and the Baked Chicken Farm for making this possible. Let's get this thing started, guys. All right. Tuesday evening, pretty cool stuff. All right, so look at this. Rite Aid, pharmacists in Maryland get the okay to dispense prescribed hormonal contraceptives. Well, why is this important? So about 3 years ago when I worked for CVS, I wrote a prescription one time for somebody who came over the counter for a hormonal contraceptive. Someone had referred them to me because they knew I had the prescriptive authority to do so. However, I got a little bit of a slap on the wrist from upper management saying, that's not company policy, regardless if it's New Mexico law. It's actually something that we cannot allow you to do here, so don't do it again, right? Anyways, all that was doing really was restricting healthcare access and, adding to the burden to our already burdened healthcare system. Unfortunately, moving out of CVS Pharmacy, going into Mesilla Valley Pharmacy, jumping in with the hormonal contraceptive initiative and being able to prescribe using my prescriptive authority was a great place to have some interventions there. We had some good relationships with Planned Parenthood, so on and so forth. And, even expanding beyond that now with Pharmtrue and everything, guys, that's exactly the lens of the world that we want to see, whether it's your endocrine system, endocannabinoid system, cardiovascular system, pharmacists help take care of it all. Medications are a part of the whole deal. And, for us, where we look at the corporate world actually allowing this is pretty cool. Where you see other companies investing in all these telehealth services and, in-house hubs, allowing your pharmacists that are already there to work at the top of their license. What a smart idea. What a smart idea. Maybe they're more than just giving vaccines and, final checks on prescriptions and not even having enough time to do that, guys. Give me a break. So anyways, heck yeah to Walgreens, or heck yeah to Rite Aid here for this, allowing their pharmacists in Maryland to actually do that. Well, they're also doing this in California, New Hampshire, Nevada, and Oregon. So in those states, they're going to be rolling out pharmacists prescribing hormonal contraceptives. Badass, for sure. One actual Goliath corporate big box move that I respect for sure. Now let's transition into our tech talk, where we're still talking about corporate big box moves. Now this article, I guess headline is from a month ago, but it's something I hadn't gotten to talk about yet. And this is the virtual care launch from Walgreens. Basically, this is following the virtual care launch from Costco and Walmart. And let's talk a little bit about this. What are they exactly trying to do, right? They're trying to do telehealth. And again, there are probably good interventional places where telehealth could be a good thing. You know, we know that Walgreens has a bad reputation of, you know, over promising and under delivering and shorting their employees in the meantime. Well, hopefully, this can maybe actually help with some of the gap. This isn't anything that's covered by insurance, but these primary care services, pretty interesting. Most chat-enabled virtual visits at Walgreens will cost $33 out of pocket. Video visits will vary from $36 to $75. No insurance accepted for Walgreens virtual healthcare. Costco is providing its members access to virtual primary care at $29, health checkups with a standard lab panel, and a virtual follow-up with a provider at $72. So that's pretty not bad, right there for under $100, or for, $101, you can basically, if you have diabetes, you can see a lot of good indicative markers there, guys, just by our community going out there and actually getting their blood work done and knowing their numbers. It's more than just, hey, well, my BMI is a little over, I'm okay, I'm not super obese, so therefore I must not be having other issues. I may not be recognizing you're pre-diabetic, or right there on borderline type 2, high cholesterol, so on and so forth, things that we can discover with testing. Even thyroid, right? Endocrine system, things being off. Hormonal contraception, something that we were talking about, but other things like just straight up hormone replacement therapy, right? Something that isn't necessarily probably going to be a part of this model with Walgreens virtual care, but something that I think is going to still be a very big part of the integrative medicine virtual model here in the future. So where you're looking at Walgreens and Costco and Walmart. So Walmart's is actually more of an in-house solution that they're rolling out. Walmart's is going to go to their employees, offering their employees primary care services through their own benefit program. And I think that's actually pretty cool. So shout out and kudos to Walmart for that, because taking care of their employees first before they try to roll out some big initiative to the entire country, I think is a great place to start. And maybe Walmart will actually have a little bit of time to get that right, invest in their employees' health before they start trying to tackle big things just to chomp at profit, right? $29 virtual healthcare appointment, once they start racking those things up and they give you 10 minutes at a time, and they can sit there and, obviously how many, hours is that, or how many sessions is that? Would you put in a 1 hour session? That's 6 sessions, $29 or $37. All of a sudden you can really work it. You can really work those numbers. All of a sudden a doctor's time is worth, almost $200 an hour there. And granted, we know lawyers are probably the most notoriously expensive out of all of that, but in terms of the billable time there, that is a great rate that they are going to squeeze out from their medical providers, but at the same time, at least give some access to primary care, where we'll talk about the benefits of where virtual health services actually, could have a real good impact. And then some of the other ones that we might kind of want to pull the brakes on a little bit right now before we really further evaluate the efficacy. So let's move on. I like this little article here. The headline's a little bit misleading. Virtual healthcare has limited benefits, study finds. But when you're talking about limited benefits, it's kind of the lens that you're talking limitations, and I don't think exactly that's what the point of the article is getting at here. So anyways, so out of the UT Austin McCombs School of Business, researchers found that telehealth did not significantly reduce costs or the number of future visits to emergency rooms or specialists for circulatory, respiratory, and infectious diseases. Okay, fair. That's totally fair. Doesn't that kind of make sense? How is telehealth, really going to, I guess, right away make a great impact when it comes to emergency room, circulatory, respiratory, and infectious diseases? Telehealth, it's really hard to coordinate things like bacteria swabs, or to be running, IVs and be running PICC lines and, all those kinds of things. You need direct patient care there. You need the doctors, the nurses, the entire team on staff. That's usually why they have what's called skilled nursing facilities, assisted living facilities, obviously your acute care in the hospital. But again, because those kinds of scenarios literally impose a strict amount of pretty much 24/7 care and monitoring, I mean, our health system is not right there to be able to enable patients to, just be at home and somehow imagine that you're going to have your PICC lines and a nurse is going to be able to be on call, like truly helping you there, right? So let's just kind of be real with that. So circulatory, respiratory, infectious diseases, if you have MRSA, maybe if you had like a little, like, I guess, robot or telehealth visit with your doctor from, across the room or something, if it was something super, super, super scary, right? Like, then maybe that's a good reason. But at the same time, doctors need to see their patients. You're not going to get a good measurement on markers. And if something goes south, again, what are you going to do? You have to go back to the hospital. So where you're talking about future visits to emergency rooms, you may not be doing a very good job in terms of getting the person off and on their own, by themselves, trying to manage something when you're even looking at IV infusion therapy and some of these other things. Good infusion services are going out there to their patients' houses, running that. They've got face-to-face interactions throughout the whole thing. And again, very limited amount for good virtual intervention. I wouldn't say that virtual intervention is by any means something that you could really account for when you're looking at circulatory, respiratory, infectious disease and emergency room visits right now. You just can't do it. I mean, you need bodies on for emergency situations and quick response. And that kind of is a make and break difference for readmission, so on and so forth. And when you're looking at costs of healthcare and the burden of healthcare, hospital costs are among the highest, right, guys? And so when we look at readmission in the hospital, it's something that we really want to prevent. Of course, we don't want surgeries. Of course, we don't want these other things that we could perhaps prevent with diet, lifestyle, non-pharmacological interventions. But again, at the core of that becomes education, awareness, advocacy, so on and so forth, and socioeconomics and the whole thing that we have going on, right? So when we start managing that and looking where's the biggest need right now for telehealth, this article, I like, the insight. So, I'm not even clicking on the study right here. I'm just going to be showing, what exactly this thing is summarizing. So based on the study of patient visits across all hospital-based outpatient clinics in Maryland from 2012 to 2021, they found virtual telehealth visits reduced the number of future outpatient visits within 30 days of a telehealth encounter by 14%, saving $239 in total outpatient costs per patient. Pretty cool. Where we are seeing the greatest impacts, from telehealth: behavioral health, metabolic disorders, dermatology, musculoskeletal disorders, the greatest positive impact from telehealth. So, right, thinking about kind of some of those things that you could manage, right, on your own. Cognitive behavioral therapy, a lot of people might feel a lot more comfortable not having to go anywhere and to just be able to talk to somebody on a personalized basis. Of course, that's a banger right there, a big winner. Metabolic disorders, when you're looking at inflammation and, other root causes of metabolic disorders, a lot of the times, you have to sit there and chip away at the block. You have to look at labs, and some of these markers and some of these things become very individualized and personalized for those patients. And, seems like a manageable thing. There's not going to be, true emergencies unless, like, you're looking at autoimmune and stuff where maybe somebody needs a quick steroid burst or something like that. But again, still things that could relatively be manageable with virtual care, just like going to the pharmacy if you need something real quick. Dermatology. Again, I don't know the dermatologist technology that's out there, because I'm sure if you do not have a good connection and you can't see what's going on the skin and the lesions and everything else that they need to treat and work up, it's probably rather hard. But I'm sure for, basic dermatology needs, acne, some of the cosmetic stuff, tell you the truth, is probably going to be very, very achievable. Wrinkles through dermatology, and even at least, somebody that may have never considered getting like a spot checked, right, may actually just be a little bit more adherent or more likely to talk to their dermatologist about it through, a dermatology appointment. I know here in town, right, like, and between here and El Paso, to get a dermatology appointment, you're not getting it next day, right? And it's going to be a big pain in the butt. And some people, a lot of those dermatology people, you're seeing, teenagers that want Accutane, or teenagers that want antibiotics, or your retinol creams and things like that for, again, cosmetic purposes, acne. And then you have your older crowd, anti-aging crowd, that definitely wants those cosmetic retinol creams and so on and so forth, right? So I think that's a big majority of the dermatology market. And so don't get me wrong, granted, you're going to have those people with actual issues with their skin. Those are probably fewer and far between, and a lot of the times might take a lot more sophisticated workup. So if anything, a dermatologist could get you to that point of, all right, we'll go and get all this checked, so on and so forth, and do a good job at that, especially when you're thinking, wow, I might have to wait months to get seen. Who knows what's going on with me. So very cool. Musculoskeletal, something that comment on, like, I was seeing actually, physical therapy and these other things being achieved through, right, like your AR, VR, augmented reality things. But those augmented reality machines are now kind of like starting to be primed to, track your movements. If it can tell that you're weak in one area, right, and where you're compensating and where inflammation and things are happening, how can it actually help you to do exercises to strengthen, maybe some of those musculature blind spots that we do have, and help to account for some of that just by literally being able to measure your movement, right? We are, all points on a data grid, when it comes to that, like when you're looking at gait and overall walk and structure there, whether somebody is just taking an iPhone video and looking at you and telling you and explaining to you that your hips are off and this, that, and the other is off, telling you right now, of course, they're going to be able to see a lot of that just through the camera, and then the AI and things like that are going to be able to have algorithms to be able to super detect that stuff in a very, very soon future. I'm optimistic about all that. And otherwise, physical therapy can be a big pain in the butt, a big adherence problem for people to get rides, to go do, those workouts multiple times per week, and therapy sessions, so on and so forth, right? And it's easier to, if, people can get a weird lack of motivation there. Well, where could, telehealth help people that don't have a physical therapist within driving distance, don't have the ability to drive, so on and so forth, where healthcare access really could be needed? That's pretty cool. Musculoskeletal disorders, not just personal training, not just Wii golf, things like that. This is, people's lives, people's quality of life, right? Get you back going. And I think it's very cool. So again, diseases for heart, lung, or those involving infection symptoms are more difficult for patients to communicate and for doctors to observe over video. And the limitations currently are not providing much of a benefit to care. So when we're talking about that, guys, I think, the best quote here, the effectiveness of telehealth is really a function of the type of disease that it is used to treat. We're looking at some of these primary care services, even here in like the state of New Mexico, in our rural communities, so on and so forth, guys. A lot of people just need to be able to go to the doctor, and be able to do that, whether they live in the boonies, or whether all the doctors are already booked, or whether the doctors take their insurance, or whether they have money to pay for it, or so on and so forth. Healthcare access is a big deal, and telehealth over there truly should be a very promising thing, even in the matter of this year, right? Like, I think the common mental health telehealth app that everybody's seeing the ads for right now is like BetterHelp. But again, even if people are paying the 100 whatever plus per month for those therapy services, you get that personalized virtual care, and it's obviously taking off. That's a super good example of something that's working right now. And kind of looking at some of the core of some of the other issues, mental health could really be a big factor there. So where maybe people might be being healed, with their mental health, they're probably gaining other positive benefits, in their other aspects of their life, whether physical, emotional, things like that, and thus hopefully reducing other negative health outcomes. Doesn't always happen. I mean, okay, I'm going to say this right now, and you guys can hang me out to dry for this one. I don't know if this is accurate or not. Somebody I thought was kind of a decent example. Maybe it's not a good example, but okay, so like Jessica Simpson. Let's just put it right there. Has anybody seen the new Jessica Simpson? And now that she's not an alcoholic anymore, she looks completely different. And again, right, she looks healthy and all those things like people have noted. However, right, she's definitely put on a little bit of weight. And so on those regards, it's like, well, how much is a little too healthy, where you might be a little pre-diabetic or something like that. So again, you don't want to trade alcoholism for diabetes or something like that. And that's maybe where mental health and some of that self-control or whatever else could be a really big factor. But I guess if you have to choose between alcoholism and pre-diabetes or whatever that might be, good for Jessica Simpson overall. I'm just saying, an example that maybe publicly people have kind of commented on a little bit and one way or another. And I truly, I commend her for everything that she's been through there and, finding herself and being totally about all that. That's great. So anyways, let's segue that into our tech talk segment, guys. Talking about cannabis and mental health. I want to kind of bring this one to light here. Give me just a moment. So some important stuff. Men's health, mental health awareness month, testicular cancer, prostate cancer, everything in Movember is a big theme. May is like American Mental Health Awareness Month overall. So either way, every day should be a day to consider mental health, right? And for cannabis, it's an interesting scenario because there's so many different plays that cannabis can help or hurt your mental health. And so it's a very delicate balance. And I think, being able to discuss that with people and just being transparent and upfront about that is a really good opportunity to create really good conversations, especially for positive use of cannabis, right? When people sometimes may realize they may have something being exacerbated by THC, right? Whether it's like psychosis or schizophrenia, bipolar, or something like that, something to be, cognizant about, right? Do you have, anxiety associated with, one of those kinds of things or other mania and manic episodes, right? Associated with, that. Well, THC can hurt those situations. Those are situations where we don't want to introduce too much THC because, again, you might induce even more anxiety attack, more panic, all of those negative side effects that you wouldn't want to induce, right? But it's interesting that the healing power of cannabis, whether it's through CBD or THC or low dose THC, so on and so forth, well strategized and well placed, gives you a lot of options and opportunity. But right, when we're looking at cannabis and the mental health, just in general, it's like it's something that we want everybody to be mindful about because there's so much there that is not fully understood. And let me just break this down. Adolescents, they're my take-home greatest example here. So adolescents, complete delicate balance between the potential risks and the therapeutic benefits for specific conditions that indicate endocannabinoid deficiency. Do we know every condition that indicates endocannabinoid deficiency and exactly how the endocannabinoid deficiency presents so that you could thus supplement it, such as you're low on iron, take this much iron, you're low on thyroid, take this much thyroid, right? No, we're not at that. But, from some of the pioneering providers like Dr. Bonnie Goldstein out of California since 1996 has been absolutely, working with your pediatric population, your adolescent population who are suffering from, autism, epilepsy, Tourette's, so on and so forth, in giving them various combos between high dose CBD, low dose THC, even adding and sprinkling in CBG, so on and so forth, and having very good positive results, like, complete turnarounds in these youth. But at the same time, on the other side, young adolescent brain that's developing, that has everything it needs, its endocannabinoid system is all good to go. Again, those acute, memory lapses and things like that do have a small effect on that adolescent development of the brain. And that's something that, because we don't understand very much, and we don't know if it's temporary or not temporary, and we don't know exactly how, it all really fully relates to that full development of the brain, we definitely do not recommend, adolescents who are of regular homeostatic function to use, cannabis. There's no need right there in those situations. Maybe CBD perhaps, or maybe like topical stuff, I guess, right? I guess, where I'm thinking the high school athlete who's popping, Motrin or Tylenol like it's Skittles because they're going hard at practice every single day. Maybe we're setting our son or daughter up for a path of kidney failure, for a path of high blood pressure, for a path of liver failure, right? So on and so forth, where maybe we could be setting up for a little bit more of a natural anti-inflammatory response with something like, CBD. And this isn't something to do with mental health. This was just, right, kind of giving you the framework. But just interestingly enough, we're in our adolescence, there is a big contrast between both sides and a big delicate balance between the potential effects or the potential exacerbating, effects and the potential detriment to the development of the adolescent brain. So we do, when I talk to youth, things like that, when I discuss it, I definitely want to empower youth to, want to have the best brain that they possibly can have, right? I think that would be my argument there. You wouldn't want to diminish, the development of your brain. And even if it seems like something that you're going to do for a quick, fun time, perhaps not, right? So area of concern, right, would be cognitive deficits, including challenges in attention, memory, and executive functioning. But again, the time of all of that, whether it goes away when the cannabis goes away and it never really, messes with the impact of the growth after that, we don't really have a good understanding of that. Other than that, let's talk about some other stuff. So the big, right, hallmark example that, mental health and cannabis, right, adolescence was a huge one. And where you look at adolescence and cannabis use and adolescence and all that kind of stuff, humans mainly hit their first trauma by the age of 14 on average. And so where you kind of correlate that with, drug and alcohol use, so on and so forth, it's a pretty interesting, relationship there between not only, cannabis, but, trauma and things like that. And why are people, turning to cannabis? Because they are trying to, deal with their trauma and maybe trying to self-treat and maybe not knowing why they're doing it. And that's not something we want to encourage our teenage population. But again, for our adult users who can, use this, like, guys, PTSD is a huge, huge benefit already clinically shown with cannabis, right? THC in the prefrontal cortex, reducing, the amount of traumatic memories and actually helping to extinguish them and helping to, delete almost out those anxiety responses and diminish them to, such a point there where recurring thoughts, recurring memories, things like that, which truly can impact somebody's life, putting those, helping somebody manage and get those onto the back burner, physiologically. And that's awesome, right? So when it comes to PTSD, most people, have some form of trauma and PTSD that they have suffered from in their lives. Maybe self-medicate to treat with alcohol, maybe, don't need to do anything about it. Maybe you're just good at talking it out or whatever that would be. But again, where people jump over to SSRIs, where people are jumping over to, only alcohol, or even somehow making their way onto, right, benzodiazepines, and even somehow making out to opioids just to be sedated, right? Whatever. So it's all weird. It's all interesting. But PTSD, such promising benefit. Let's talk about some other ones. Psychosis and schizophrenia, not so much, right? As we talked about, big correlation significantly between, cannabis use in schizophrenics who develop, psychosis. And again, it's something that if you've got schizophrenia early and you especially was undiagnosed and you ended up into, using higher doses of THC and that like that, you're definitely, setting yourself up for failure. You may not even realize it. You may think, that cannabis is helping, but it ain't. So bipolar, right? Bipolar can even, heighten symptoms of mania and hypomania when cannabis is used. So looking at all that, those are very fine lines and different, obviously, disease states. And when we're talking about adolescents or people with autism or epilepsy, it's not only adolescents that suffer from autism and epilepsy, adults do too, right? So it's just a lot to unpack there. And every single person at the end of the day is going to have a very different, workup for what they need. But in terms of promoting Men's Mental Health Awareness Month and everything like that in our Herbal Wellness Corner tonight, guys, cannabis can definitely help, but it can definitely hurt too. And that's something I hope that you guys can have a little bit of a better understanding on as we talk this out tonight. We're not going to sit here and dissect each and every single individual study there, but again, this is all backed for sure. All right, guys, let's move on. Community Spotlight, shining a light on High Horse Cannabis Company. High Horse Cannabis Company's Winter Coat Drive. Guys, so giving season, and in that, High Horse Cannabis Company is doing a coat drive to help support those in need within our community. It's beginning to get cold, and we don't want to see anyone going without out there. So again, there's also a canned food drive within High Horse Cannabis Company. In exchange, guys, for your good deeds and donations to our drive, you would receive a coupon for a penny pre-roll with a donation of at least 5 canned food items or a brand new coat to be redeemed at your next purchase. So again, it's a pretty good deal there, guys. You can go and get your medicine at a discount there and help somebody out this winter. So either non-perishable food items, please drop those off, or coats over at High Horse Cannabis Company to redeem. All right, let's end this one on a happy note. Movember's coming to a close, guys. But it doesn't mean men's mental health awareness, men's prostate awareness, cancer awareness, testicular cancer awareness should ever go swept under the rug. But guys, some of my favorite facts from Movember, got to share them with you. So first one, Albert Einstein had a mustache for over 50 years. Who knew that? The world's longest mustache is believed to be a 14-foot monster belonging to Ram Singh Chauhan of Rajasthan, India. He regularly massages it with mustard and coconut oil to keep it healthy. In 1967, the Beatles gave away cardboard mustaches with their album Sgt. Pepper's Lonely Hearts Club Band. Police in a district in India's Madhya Pradesh state are now being paid to grow mustaches because bosses believe it makes them command more respect. A 1-month-old mustache is capable of holding approximately 30 milliliters of liquid, or around 10% of a glass of beer, before leaking its contents down the face of the owner. Hilarious. Salvador Dali published a book dedicated solely to his mustache, and the average human hair grows at a rate of 0.014 inches a day, or about 5 to 6 inches a year. Anybody have a guess on how many hairs there are on average on a man's face? Between 10 and 20,000. LOL, so pretty crazy, right? Anyways, happy Movember to those of you guys who grew mustaches. Appreciate it. Shouting all you guys out. Some great stashes for sure out there. But again, Another mustache shout out I must also give to our very own NMSU Aggies. Guys, Pistol Pete, that mascot, has got a sweet mustache. As someone who's donned the stash before, go Aggies. And again, my upper lip about right here, I don't think my mustache will ever close just because of the super glue that I would put right here to glue on my little mustache, because I couldn't do that. I couldn't do it real good. You know, it was less about the stash and more about, just the valor that to get it done. Go Aggies, baby.